Patient expectations and clinical concerns. Now, as a hospital, you have to provide medical care regardless of a patient's disability, age, ability to pay, sexual orientation, national origin, sex, color, creed, or race. Cannot discriminate. Patient expectations and clinical concerns. So whether a patient shows up for a scheduled surgery or an emergency visit, patients and their families always have questions and concerns and worries. So we want to make sure we're doing the best that we should do, which is to pass those questions and concerns that are not within our scope to the appropriate staff members. So if they come in and they need some guidance that's faith-based, we want to refer them to the pastoral care department, spiritual care department, and make sure that we're always referring the questions and the subject matter to the subject matter experts, which are our colleagues in those appropriate areas. Okay, let's review questions related to your role. I've broken this information into 5 categories. The first section is patient's demographic information, followed by obtaining healthcare insurance information, then documenting medical information, capturing a patient's special needs and language preferences, and last but not least, the financial obligations. Okay, let's take a look at a patient's demographic information. Questions related to this section. Of course, we want to find out what our patient's name is, but an important way to do that is to ask for a form of identification so that you will not get the name misspelled. It's a good point of reference to refer to a driver's license or a photo ID of some sort, or again, just have a conversation with your patient, validating the way that they would like their name to appear within the system. Repeat information back. Validate what you have in the system or what you're about to type in for the first time. Date of birth. Again, we can use a passport or even a driver's license, but I'll be cautious to say that when looking at passports or identification from other countries, that we keep in mind that the format of the date of birth may not be the same. The month usually appears in the middle and not the date. So it's easy to take a look at someone's date of birth if they are from another country and automatically assume that the number in the middle happens to be the date. And in fact, that's not the situation. The date of birth format is actually day first, then month, then year. So just be mindful when you're looking at other documents that are outside of the US. Again, verify with your patient that the date of birth that you're about to record in your system is indeed the right format and is indeed the right date of birth. Address. Again, I go right back to making sure we have some form of written documentation. If the patient has a driver's license, you can definitely use that or validate, is the driver's license address even current? Perhaps they have a change of address card that they can provide you. And again, have that conversation. Phone numbers. We have to remember that patients and their family members are often in an anxious state and they may rattle off a phone number, but it may not be correct. Or you could be sitting in front of a computer and the old telephone number or old cell phone number is been recorded from the last visit that they had. Again, validate what you see. Patients' race and ethnicity are not the same. Please make sure that your patient is self-identifying and telling you what race they would like to have listed in the computer system. Ethnicity has to deal with whether a patient is Latino or Hispanic or neither Hispanic or Latino. Depending on the drop-down menus that are in your system, please make sure that you do differentiate and are able to communicate properly the difference between ethnicity and race. Gender. Again, this is another category where the patient does need to self-identify. Just because you perceive a patient as being one particular sex doesn't make it so. Have a conversation with your patient and ask them. It may be kind of awkward, but you do want to get that correct. There are certain medical tests that are triggered based upon a patient's sex, male or female. Emergency contacts. This includes the support person, next of kin, person to notify. These emergency contacts' names and numbers should be accurate at all times. There's nothing more painful and embarrassing to have an emergency contact be one of a spouse or a family member that has passed away. Again, don't assume that the information that's on the computer is accurate and current. Your job is to validate and make updates or put the information in for the first time. Email addresses. There are a lot of systems that work off of an email address based upon the patient providing one. Let them know that it's very important that we obtain the email address so that they will be able to access other great sources of information, such as a patient portal, perhaps. Organ donor. If a patient is an organ donor, this may or may not be a field that you as a registrar are asked to collect. But if you are, make sure you ask the question and that you appropriately choose the correct option. A patient's employer. If a patient has insurance provided through their employer, that information is equally important in case there happens to be any need to do follow-up. But just from a demographic sense, we'd like to always find out if our patient population is employed or not employed. This may trigger or prompt the institution to do further investigation into finding out what kind of services are needed from a financial obligation if the patient population demographics tend to be unemployed. Social Security number. This is one of my golden nuggets. Social Security number accuracy often leads to making sure that we've picked the correct patient out of our master patient index file. It is a unique number given to a person, and it definitely validates our master patient index to ensure that we are selecting the correct medical record.